I'm going to hand you over to one of our patient users, Fran. She's been a frequent user of PKB since 2017, and I can't wait to hear her presentation. So thank you again, Fran, for doing this, and I will hand over to you now. Thank you.
Thank you, Sally. As a patient, I'm often asked what induced me to use PKB in the first place. And I think to try and explain this, I need to share with you some of my medical history. About 20 years ago, a routine blood test at my local hospital revealed acute myeloblastic leukemia and a prognostic of 2 months to live, which was quite a shock, as you can guess. Treatment started, and I was hospitalized for 10 months in full isolation, which is a very long time. While I didn't realize that at the time, because obviously I was extremely ill, not always compos mentis, the context, the environment were to play a very important role later on. How can I explain this context? It's not easy, actually. There was complete transparency and openness. I was strongly encouraged to read and use my medical file. In those days, it was on paper, so there was this very, very thick manila folder, which was often left on my bed or put on my bed as a nudge. And if I had to go to another part of the hospital for a procedure or surgery, I carried my paper record. The clinical team was very, very keen to involve the patient. Fighting leukemia, fighting cancer is extremely difficult. And for the team to try and have the patient interested, even in trying to read something when the patient isn't feeling well, that was very important for them. And for me, which I didn't really realize at the time, but now I can see the beauty of it, it was very important psychologically, because it meant that I was being treated as a fully functional human being. Despite the fact I was bedridden, obviously, with a central line to be fed and for medications, chemotherapy, I was extremely impaired. It's a horrible word to use, but at the same time, it's true. I was a vegetable, but for the team, I wasn't. I think this is probably kind of cultural phenomenon, which is extremely important. Recovery after discharge was obviously difficult, as I had also acquired 2 lung diseases. I have aspergillosis and bronchiectasis, which in fact explains why I'm suffering from breathlessness and why I'm going to take a sip of my water. My water bottle, which is not quite proper, but because I suffer from osteoarthritis and very, very painful osteoarthritis, as you can see from my splint, this bottle has a shape which is much easier to hold than a cup. So do excuse me if you see the bottle of water appear on the screen. Right, medical situation. After discharge, I had many appointments in different care settings. I had a need to manage all these appointments and the actions to be followed. So I started a very simple log on a MS Word table, simply to record the kind of when, where, why, what happened, outcomes, and as well as paper files in my filing cabinet was getting fuller and fuller by the day, more or less, with paper files, letters, articles, patient information leaflets, etc., etc. So until PKB, I was really a kind of traveling salesman, going to appointments, to any care setting, with lots of paper files and also a tablet which had the digital data on it. Another area of difficulty I found after discharge was the non-access to GP records online, which is still lacking to this day, since patients have no access to their summary care record. I mean, they only see a very limited medication list and a few allergies and a few transactions, and that's it. PKB 2017. I often say it changed my life, and this is not an exaggeration. In my case, and I'm fully aware that every single person is different and will, in collaboration with their care teams, adapt and use the interaction afforded by PKB in different ways, as we've heard, in fact, this morning from the professionals. I'd like to focus on 4 different reasons why PKB is so important to me. First of all, communications. PKB offers very user-friendly 2-way communication channel with all my secondary care teams for all clinic appointments, outpatient clinic reports, discharge summaries, and well-designed messaging facilities, data sharing with my community pharmacist, researchers, anyone else I choose. And one thing which is extremely important is that, in fact, there is a choice for the patient to use different methods of communications within PKB. I think messaging was covered extremely well this morning, so I will not mention messaging. I will mention something which is, again, extremely simple, is every year I do a report on the number of bronchiectasis flare-ups I've had during the year, and also whether my aspergilloma is showing up or not. So at the end of the year, I will upload a report to my PKB, which then goes into my hospital record. And what I have done recently was to combine all these reports so that basically any healthcare professional or any health or social care professional accessing my PKB will see something like 6 or 7 years of these reports. What do they include? Well, the duration of the flare-up, the intensity, the duration, the symptoms. Sometimes the symptoms are slightly different. And what the patient, what I have done to cope with the situation. Very importantly, it includes the medications. For instance, whether I have used or not my rescue pack, my home standby antibiotics and steroids. And this is quite important because it means the doctors can follow whether my bronchiectasis can be treated as a self-limiting infection, where I manage actually to go through the flare-up, which can last something like 4 to 5 weeks, without using antibiotics. This is extremely important given the fact we have antimicrobial resistance, as you all know, and we also need to try and conserve the few antibiotics which are still working, the same way as we have to conserve our planet as well. So this is important also for doctors who may want to give the patient a delayed prescription. It's easy for the patient using PKB to indicate whether they've used the antibiotics or not. So I will not, I won't go on too long about this. At the same time, this is an area which is important and needs to be disseminated to patients as well, because it's very easy for the patient to note what they have decided to do or not. Second reason why I use PKB, test results. Getting my blood results in real time is, of course, priceless for someone who has survived leukemia. Receiving all the pathology imaging tests in a user-friendly way in one place is of immense value. The patient can also add test results, and that's another brilliant functionality. In my case, you may ask me, in fact, what test results I would upload. Well, I have uploaded the results of my last oxygen test assessment, which was done before the pandemic, obviously. because such a test does not link automatically into my hospital Cerner EPR. So the hospital lung technician gives me an A4 paper printout, which I take home, scan, upload to my PKB. Another situation was that of a cardiology community clinic, which, while contracted by my hospital, is not linked to the Cerner EPR. So the clinic consultant and the report and the electrocardiogram results were sent to me by post, and I scanned and uploaded them to my PKB record. I think these two examples are quite interesting, as in general, across the UK, I think we're going to face quite a lot of situations where online linkages, interoperability, will not always be possible for any reason, but also the kind of old estates we often come across in care settings. So the patient, in many ways, can serve as a good integrator. And that's something which I think we also need possibly even to research a bit more. Third reason for loving PKB, medications. The reality is that, I'm going to sound very arrogant here, the reality is that the patient is the only person who knows what medications he or she is really self-administering or not, as the case may be. Another factor is that for any patient, the term medications includes prescribed medicines, OTCs, supplements, inoculations, medical gas, such as my home oxygen, and more. I know my compliance, my adherence to pharmacotherapy has increased since I started listing all my substances in my PKB medication list, which is the only possible up-to-date and fully comprehensive record. The medication list is well designed to enable start-stop dates for all my meds, as well as providing a free text box for each item entered in the list. For instance, I have an off-label medicine where I can list the name of the endocrinologist who prescribed it, and who would need to be consulted if someone were to de-prescribe it, to stop it. Another example of how I use the free text box is that of the maximum flow rate which I'm allowed for my home oxygen use. That information is also very important because it's not listed in many places. The fourth reason is, the fourth and last reason that I have for using PKB is what I would call in their shoes. By that, I mean that over the years, I have become sensitive to how I can help any health or social care professional to get a full picture of all my disabilities and impairments by generating symptom and other reports, adding specific data they would not have access to, such as care plans from other care settings, adding new data. Basically anything which, when I enter data into my PKB record, I always think that what can I do to save them time, and also to prevent errors. If they have my full medication list with all my substances, they're far less likely to prescribe or recommend something which could create an adverse drug reaction. So, as mentioned earlier, PKB's versatility, flexibility in allowing patients to input care plans or self-generate care plans is really paramount. Over the years, I've also seen my care teams use data in their reports, which in fact I had generated by PKB record, which is not just very pleasing, but it also shows the true collaboration and partnership between the professional and the patient. And that's something where without PKB, it's very difficult to have this very tangible partnership. It also shows a positive level playing field. The professional has his or her EPR. I have my PKB tool, and both in the case of my hospital, Cerner and PKB, link extremely well. I'm sure there are lots of things I wanted to say, and of course I've forgotten. After all, I'm 77 with all kinds of impairments and multimorbidities. So I would be very happy to answer any questions you may have, which may in fact help me to remember certain things. Thank you.
Fran, you were perfectly to time then. Thank you so much. I didn't even need to give you a warning because I could see that you were on track. So thank you so much. That was so interesting. And I think we're really grateful that you could come and talk to us from the patient perspective, because I think it's something that often gets forgotten about. So thank you for that. I've not seen any questions come in yet. Does anyone have any questions that they'd like to ask Fran around either her use or her opinion of how PKB and the patients could support you from a professional perspective? Oh, there we go. We've had one in for you, Fran. Do you mind us quoting you when we're selling this to our clinicians?
Of course not. No, not only you can quote me, but also if you want to email me and ask me for support or to clarify something, or what, for instance, the patient would do in a certain situation, please feel free to get my email address from Sally from PKB. I would be very happy to help anyone.
I can confirm that Fran helps me all the time, and I'm always recommending her to areas that are looking at setting up patient representative groups, and Fran is so helpful to everyone. So please do take her up on that offer, because she's invaluable. We've had another question come through. Do you have any suggestions as to how we could encourage clinicians and especially patients to use PKB? Are there any other ways that you'd like PKB to be used?
Yes, something in fact which is very important that I haven't mentioned is that I think personal health records, I'm going to look at PHRs in general, and of course PKB, they are really to be driven by patients. To use the term transformation or even revolution in health and social care in the UK, I think this is what's happening with PHR. To me, it's my experience with PKB. It's a revolution. It's a new world. It's a new ball game. It's absolutely wonderful for the patients. And if the patient is aware of, the professional trying to place herself in their shoes, this is really great. And I think patients can form PKB users, patient PKB users can form patient groups, local support groups, and basically go and campaign and raise awareness of PKB wherever they are. In terms of clinicians, I think it depends very much, I think, on the medical history. The reason I mentioned what happened to me during leukemia in terms of transparency, openness, the culture was absolutely, the clinical culture, the team culture was brilliant. This does not always happen, as I think we all know, across different care settings. I think we probably have a problem in primary care in terms of transparency and openness. But I think, again, it's something the patients have to drive in terms of being themselves open and friendly with, let's say, with GPs.
Thanks, Fran. I'm sure there might be some follow-ups to that as well. We've had another question come in, which, if it's okay, I'll read the question out so everyone can know it, but then I think it might be helpful if PKB just address this first. So one of the questions was, Fran, when you add your own blood test results, how do you know the normal ranges of blood test results? Maybe helpful if PKB could autofill the normal ranges. Now, I'm not a clinician, so I might defer to Mohammed here, but I'm going to say that PKB couldn't do that because normal for different individuals might be completely different. Therefore, PKB as the software would never be able to know what normal is, which is, I think, one of the reasons that we couldn't do that. And Mo, please do jump in and correct me if I'm right or wrong there.
It's lab specific, Sally.
Yeah.
We can't make that assumption for the lab.
But I think, Fran, it's a really interesting question for you as to how do you know your normal ranges? If you could talk us through that.
Well, first of all, I would say that I would only upload blood tests to my PKB if, for instance, I were traveling and I had blood tests done in a different country and I brought back a piece of paper with me. So I do not upload that kind of test. In terms of reading my blood test, one thing too, I think I haven't said, is that with PKB, I see something like 6 or 7 years of blood test and the ranges and the ups and downs and so forth. Whereas with GP held records, GP online records, the blood tests are there only for 6 weeks. So the patient's got to hurry up to download these results. So that's a big problem in primary care. The results on PKB are also linked to labs test online. So if there is a particular test, not just blood, it could be any type of test, which I don't fully understand or don't fully understand the range, or if I think I'm too close to the range or I'm over the range, below the range, I can use lab test online to get more information. I haven't really had any questions because of the hematology team during leukemia, but also after leukemia, kept me in check. So I can really follow the result quite easily. But the PKB allows the patient to seek help in different ways as well. So that's not a problem, far from it.
Thank you, Fran. I'll just give people another couple of minutes before we move on to the next talk in case there's any more questions. But I would also highlight to everyone that we have a new YouTube channel that we'll be starting to promote soon as well. And Fran was actually one of our first videos on there. I don't know if you know that you're on there yet, Fran, but the interview that you did with Mohammed actually in person before pre-COVID, that was one of the first clips that we put up. And I know you've given us so much invaluable material over the years that we are digitizing and getting up there now. So I'll be sure to send that round to everyone, because I know that your story and the way that you talk about your use of PKB really is a nice reminder of the value that patients and professionals can get. So thank you for everything that you do to help drive that agenda forward. We appreciate it so much.
Thank you. And thank you to Mohammed.